It's Good Day New Mexico with Casey Messer.
Hey guys, good morning. Welcome to our Good Health Tuesday edition of Good Day New Mexico. Coming up, there's new technology when it comes to treating concussions. Well, it's estimated that 3.8 million concussions happen every year, and each one is unique, making it difficult to diagnose and treatment a challenge. But new technology is shedding light on what's really going on in the brain. And with the release of the new Will Smith movie, Concussion, it's a hot topic. So here with more is sports neurologist Dr. Kutcher and NFL Hall of Fame running back Curtis Martin. Fellas, good morning. Thanks for joining us.
Good morning.
Yeah, thanks for having us, Casey.
You got it. Well, doctor, I want to start with you. Tell us a little bit more about concussions. Why are they so hard to diagnose and to treat?
Well, they're so hard because every brain is different and every response to injury is different. And so how patients feel, the things that they might do when we test for their effects of concussion is going to be different. In a lot of cases, people can be injured and not even know it and not produce any effects that physicians can actually diagnose. So it's a very, very complicated injury.
And Curtis, you've had some personal experience with concussions. So can you tell, what do you want parents and kids out there to know and realize about concussions?
Well, number one, that I think you have to be very responsible when it comes to concussions. When I played, I was the type of guy who never wanted to come off the field. So regardless of the severity of my injury, I wanted to stay in the game. I think with the information that we have now and the way technology has caught up to the issue, I think it's equipping us to make more informed, more responsible decisions.
Now tell us a little more. Because of Hollywood and the new Will Smith movie, is this shedding a whole new light with the need for technologies to help, learn more about the effects of these injuries on our brains?
Well, there's no question that a major Hollywood movie is going to continue to shine the spotlight on concussion and really just turn it up even brighter. And, the first thing is it's not really about concussion as much as it's about the long-term effects of brain health over time. And that's not so much a concussion issue as it is one that is from repetitive hits. But in either case, having a tool that measures brain injuries directly and how the brain is functioning while it's injured can help physicians take the guesswork out a little bit of some of the clinical effects that we may be seeing when we evaluate a patient. So a tool like brain network activation, for example, or BNA, is a tool that provides a brain mapping solution for how brains are performing tasks. So we ask patients to do a task, and we look at how healthy the brain is forming networks to get that task accomplished. The patient sits in front of a computer, performs a task, and electrodes pick up the brain waves. And then the BNA tool analyzes those brain waves and creates an estimate of how that brain network was put together to perform that task. Regardless of how the person does on the test, this is the important part. It's not a performance-based task. It is how does the brain get organized and produce the effect of the test that you're doing. So it really gives us a nice view of brain function rather than the clinical effect.
Thank you guys so much for your time this morning. Where can we go to learn more about BNA?
Well, thank you, Casey. You can go to mybna.com to learn more and to find a testing center near you.